Okay, now a quick look at skin bleaching. Okay, in the objectives, we're going to look at some of the possible reasons why people are actually doing this. I'll give you a little overview of the amount of products that are actually out there. Some pictures to show you some of the side effects that we actually get from the use of these products. And finally, briefly look at what can possibly be done to counteract this whole business of bleaching. Now, I've actually been doing this talk from as way back as in 2004 when driving home one evening on a Friday, and I saw this person selling Star on the roadside, and this was what was the headline of the Star that Friday, and I thought it would have been a good way to start the talk. The article being Big Bucks from Bleach, essentially at that time trying to show people just how much money people who actually sell bleaching agents can make. And then I'm sure you all remember this picture that was in the Sunday Bean, I think it was sometime toward the end of last year, whereby a company was actually looking to employ people, and they actually had the audacity to say that if you are not a Browning, please don't apply. So it is a problem, and it's something that as Caribbean people, wherever we go, this whole business of bleaching is in our faces, but I do believe that we have a serious problem here in Jamaica. Okay. Yeah, so why are people doing this? There are a lot of complex social and cultural reasons as to why. One of the things is the media does portray light-skinned people as more attractive. Even here within the Caribbean, a lot of our television advertisements showcase light-skinned people with long flowing hair. We find that they are actually more favored in beauty contests, television advertisements, and there are actually dark-skinned people who feel inferior to their lighter-skinned counterparts. There are people who feel that if you possess fair skin, you are at an advantage in finding a mate, you're at an advantage in getting a good job, and it provides upward social mobility. I mean, I've even had a patient who told me that I would not understand why anybody is bleaching their skin, because as far as she's concerned, I Chris already. This is what she told me. And when you really think about it, I just had to shut up. We are products of colonialism, and in colonialism, people who are lighter skinned were the ones who were more likely to be working inside the house, and the darker skinned were working outside chopping cane. So that provided a higher rank in society. Our DJs here, which act as role models, are role models for many of our young people, do involve themselves in the process. And about 2 years ago, I actually learned that actually some of our own criminals bleach in order to hide from the security forces. Who is doing this and where on the body? It's common in females, mostly seen in the young females, second to third decade. I would say it's less common in the males, but they are by no means left out, and we are now seeing more and more males doing this. Teenagers do it, school children do it, you have mothers who are bleaching their children. And the body areas that are usually bleached are the face, the neck, and the upper chest, where you see people first. The dorsum of the hands is another common site. And there are people who bleach their entire body, include their genitalia. I've seen a male who was bleaching his penis. And perianal skin is bleached as well. You may not be aware, but people who work in the porn industry, they don't want their perianal skin to be pigmented, and so they bleach it because they want it to be pink. I learned all of this doing this over the years. What is available? Lots and lots of things. There are probably about 60 different products out there. Lexus, Mercury, Movate. What is actually in Movate is clobetasol propionate. It's the same thing as in Dermovate, but it's not made by GlaxoSmithKline. Lemon gel cream we think is betamethasone valerate. There is a product called InstaClear. Fair and White is made in France. It actually has the French flag on it. Crusader, I don't know. Ultra, I don't know. Skin Success, I don't know. IKB, I don't know what most of these things are. Raw Nadinola is something that I actually learned about from a vendor on the roadside. They buy raw Nadinola in a big plastic tub, something like what pig's tail comes in. And they retail it in plastic bags. And the lady told me that if she spends $5,000 to buy the tub of raw Nadinola, when she retails it, she's made $15,000. So it's good business. Nuprazone is a very notorious one, very commonly used, very rapid. You start to bleach on Monday, and by Friday you're ready to go to the wedding. Maxilite, I don't know what is in it. Yes, they do mixtures, they compound and they mix it with toothpaste. The popular brand being Pepsodent. Curry powder is used as well. And they're not stupid because, as you may be aware, curry powder is actually a mixture of about 6 different ingredients, one of which is turmeric, and turmeric does have skin lightening properties. They use household bleach, and they prefer the granular one, the dry bleach that comes as crystals, and the list continues. And as I said, combinations are used, and you see people walking around with their mask, with a towel around their head, looking like they're having a day at the spa. What are they? Well, first of all, potent topical steroids, and as we just looked at, bleaching can actually occur as a side effect when you use potent topical steroids on areas of thin skin and for a long period of time. Hydroquinone as well. Hydroquinone is actually a skin lightening agent used to treat hyperpigmented skin disorders, which acts by inhibiting the conversion of dihydroxyphenylalaniline to melanin. We use it a lot in dermatology. And of course, ammoniated mercury. Ammoniated mercury is actually one of the ingredients in Nadinola, and mercury can actually cause nephrotic syndrome, ammoniated mercury. I have actually never seen anyone who has developed nephrotic syndrome as a result of the use of bleaching agents, but there have actually been cases that have been described. The side effects from use, and some of the side effects from the use are the desired agents if you are somebody who is bleaching. Of course, the bleaching or hypopigmentation, which is what you want to achieve. Many of them end up with steroid-induced acne, skin atrophy, thinning of the skin, stretch marks, ochronosis, which is a paradoxical hyperpigmentation of the skin, which we're going to talk about. They get inflammation, and of course, if you are actually trying to get rid of a lot of the melanin in the skin, then you're actually predisposing yourself to the potentially harmful effects of ultraviolet radiation. This is actually a 26-year-old female who was using a bleaching agent on her face for 2 months. Something was wrong with her face, apart from the fact that she said she was trying to tone down her complexion. And then she ended up with these hyperpigmented papules. So she has steroid-induced acne. This is another patient with the same thing, quite a light-skinned individual to begin with, and she was using a bleaching cream again in order to try and tone down her complexion. They use these terms. They want to smooth out the skin, they want to tone it down, they want to have a cool complexion. And when you ask them exactly what do you mean, they said, in one of them told me, well, doctor, I want to look like you. This is the same lady who we just saw before, and I think Bridget remembers this patient. She was the one who saw the patient in clinic one day, and I was the one who had the camera, so thank you, Bridget. But this is a 41-year-old female who has been whole body bleaching for 3 years, and this picture is actually one of my favorite slides. It shows gross striae on her abdomen and breasts from the use of her bleaching creams. I really don't know where the lady finds time to do this because she says she applies her agents 3 times daily. This is another one who actually was using a bleaching cream, and she only used it for 3 weeks and she started to get irritation, burning, and hyperpigmentation came to me saying that it burned up her face. Okay, ochronosis actually refers to a paradoxical hyperpigmentation or darkening of the skin from prolonged topical exposure to hydroquinone-containing bleaching creams, particularly when you use hydroquinone at very, very high concentrations. And it commonly occurs on the face, and I'm sure you've been able to recognize now that it can occur on the knuckles as well. And the problem with this and what brings them to us is that they are ending up actually darker than their original skin color, which is very irritating to them. I'm sure you've seen this sort of picture. This is a 42-year-old female. This is the same lady who has been whole body bleaching. She did not come on account of this dry on her abdomen. She didn't like that the fingers, the knuckles were starting to get black. This is a man, the foot of a man. It's not a very nice female foot. Toes are very hairy, and he was bleaching his feet using Instaclear for 3 weeks. And he's actually starting to get ochronosis over the joints of his toes. If you can see this big patch here and here, I actually thought that someone had hit her in the face. But she said no, she was using Metasol. And initially she started to look good as far as she's concerned, and then she started to develop what I call raccoon eyes. And this is perhaps the worst case of ochronosis I've ever seen. I did put her on some treatment, of course, gave her the talk, and at 6 weeks later she's actually significantly improved. And I saw her again another 6 weeks later, and she's almost completely resolved, saying that she's not coming back to see me. She thanks me very much, but they don't have any more money. Okay, what can we actually do about this problem? There's been a lot of public education that's going on to try and highlight the negative effects of the products. Many of us speak, I speak. You get the call to talk, can you come down to the radio station tomorrow at 5? It's a never-ending thing. We have been really trying, but in my opinion, I think despite the talking, despite the showing of pictures, it's falling on deaf ears. Posters are available, leaflets are available. Regulation of the side effects of the products, especially hydroquinone and topical steroid, is difficult. I mean, topical steroids are not supposed to be dispensed without a doctor's prescription. There are pharmacists that do give them to patients. They don't want to lose the money from not giving them the drug. Hydroquinone is actually banned in certain countries. It's banned in Europe, banned in Canada, I think, as well. Despite that, there is a thriving black market, and these products, as you know, are available on the roadside, dry goods stores, haberdasheries, hairdressers, pharmacies. And if you go into any of the pharmacies where these things are sold, there's a large amount of agents that you can actually see. Can we change people's social and cultural practices? That does not occur overnight. The way in which people actually see themselves within society is something that takes a long time to change. It's not going to occur in one generation. I actually refer some of these patients for counseling because I find that despite the fact that you as the doctor are sitting down and telling them you're harming yourself, and you come back and they see them 2-3 months later, they still have evidence that they're still using it. Many of them are not going to admit that they are, but you know, I have found that in order to get compliance, rather than to speak down to them and say, you're doing this thing to yourself and you're causing yourself harm, it is better to adopt an empathic approach when you see them and say, okay, I understand why you are doing this, but bear in mind that while you're doing this to yourself, you may actually be causing yourself harm in the long run. Medically, we can actually treat some of the side effects. We can treat steroid acne. Sometimes dermabrasion may even be necessary to treat ochronosis or chemical healing. I think that's it. Thanks for your attention.